Top Med Talk.
Good morning. My name is Desiree Chappell, and I am the host of the Roundtable on Top Med Talk. And I am here this morning on the final days of ACER 2018 in Fort Lauderdale, Florida. And we're able to have the opportunity to sit down with some of the participants of the meeting this weekend. And we've gotten some great information from all those folks over the course of the meeting here. This morning, we have the opportunity to sit down with an anesthesiologist, Dr. Arman from the University of Washington in Seattle. Good morning, Dr. Dahl. How are you this morning?
Good morning, Desiree.
Good.
I'm good, thank you.
Just give me a little bit of your background, what you've been doing at your facility with enhanced recovery.
Well, like all the great leaders of ERAS programs that I trained in the UK, in Nottingham, and then after doing my anesthesiology residency there, I come to Seattle to work in a trauma hospital, the Harborview Medical Center, which is part of the University of Washington. And I have been there for about 10 years now. One of my main ambitions to bring the perioperative medicine concept that I learned from UK to my practice, my organization. So I start working on implementation of ERAS type of work, pathway development and transformation of care. And we had great opportunity to work with leaders of this field. We are one of the sites for the IHI Institute of Healthcare Improvement. So we have been doing a great work at Seattle. The other thing that I sort of started to learn and felt like I need to develop myself further to help with the change management, I started to take a course on executive master's program on healthcare management at University of Washington. So I'm just finishing that, and that will also help my organization and help myself to do the change management.
The things that you already learned, have you already started implementing those within your practice?
Yes,
it's made a big difference?
Exactly. So today again we have been hearing about change management and how to sort of lead the organization, help to make decisions and move forward towards ERAS implementation. So that sort of thing is, I think, critical for sustainability of change, because we always sort of talking about let's put some care elements to help with the patient outcomes. But those care elements, if you don't anchor them well into your practice, doesn't become part of your day-to-day strategy, usually fades away over time. To prevent that, I think we start to come to the concept of, what is after ERAS? What will it look like? Are we going to call ERAS of ERAS in a 3 to 4 years' time? What it's going to become like? So we want to sort of come to the concept of perioperative medicine.
I think a lot of organizations, when they first start out, it's ERAS, and then you soon realize that that's kind of just a smaller piece of the broad, perioperative continuum.
Exactly.
And how do you manage that? And I guess in calling it enhanced recovery, I guess you can call it enhanced recovery. Mm-hmm. Have you guys thought about that model, and where are you going with that in your practice?
Yeah, so we feel, organization feels, ERAS, certainly I have been sort of partnering with my surgical colleague to implement ERAS in a system-wide level now at University of Washington. So we have 4 sites, 4 large hospitals. They're already doing ERAS, but we want to standardize across the system. So we look at the same dashboards and we evaluate our patient outcomes together. So that is going to take place. We're working hard on that. But again, when we think about, okay, we have done the ERAS components, what is going to be the next thing? As you say, we're expanding every day further out from the operating room to preoperative phase and postoperative phase, post-acute care management, discharging patients to SNF, and then how we're going to manage them in SNF. So all these things are taking place. So it's becoming more like a perioperative medicine care, and partners of this care is undetermined for now because this hasn't been the focus in medicine. So I think there's a space there to work towards developing these teams and physician, nursing, and all the allied care professionals to support that space.
Yeah. So we just have a couple more minutes now. Mm-hmm. And I was just wanting to get an idea of your feelings about how the meeting's gone over this weekend. I know you had told me that you were here 2 years ago, mm-hmm. or in the D.C. meeting 2 years ago. So what are you able to, it's been maybe a couple of your favorite sessions, and then what are you going to be able to take home with you and kind of put into action when you get home?
This meeting is always great to meet with the key stakeholders and leaders in the field of ERAS. So I had a lot of one-to-one conversations and opportunity to discuss my practice compared to others and learn from their experiences. More specifically, there was a great emphasis on hypotension-related patient outcomes, intraoperative hypertension. That was huge, I think, huge learning opportunity for me to understand the relationship of goal-directed hemodynamic management. Again, there's an emphasis on the hemodynamic management rather than fluid management now. That will guide us to make change in our own practice. So that's going to be great. I learned during this period. It was nice to see the nursing leaders coming up with their sort of success stories and creating examples. And so that will I take definitely to my nursing leadership. I took some pictures of the slides, and I will make some referrals for them to start getting excited about how they're going to produce this in a scientific platform.
Mm-hmm. Yeah, that's great. Well, Dr. Dahl, thank you so much for sitting down with us here at the Roundtable at ACER 2018. I hope we can stay in contact and have more discussion here as soon as you finish up your master's program and see how that's taking you and where it's taking your program through the next year or so. So thank you so much. Have a great day.
Thanks a lot.
Top Med Talk.
And don't forget to follow Top Med Talk on LinkedIn, Facebook and Twitter.